Good afternoon and good morning, everybody. How you doing? Um, Thanks for attending. These are the sort of the dog days of summer here. So we had a lot of people register for this webinar, but I don't see a huge live attendance. So I'm hoping some will watch the presentation later. But thank you for sitting in. I appreciate it. It's hard to, when it's a huge heat wave like this, to, force yourself to sit and do a lot of academic stuff. This is a pretty important topic, and you'll see from the slides that I have here today, which I will send to you to make sure you have them, that this really would be a 3 to 4 hour presentation, not a 1 hour presentation. So I'm going to do it in 1 hour by sort of giving you the physiology in the beginning. Then we'll move very quickly through how it affects health conditions, because it will all make sense at that point. And I'll make sure that you have the slides to refer to, because when you get them, if you just take your time and go through them, then you'll see the substantial evidence there is to support the notion that essential fatty acids can be very helpful in preventing and helping to manage a wide variety of different health conditions. But the physiology that I review with you at the beginning will give you sort of the understanding as to how and why that is possible. So without further ado, essential fatty acids in health and disease. Just let me get to my screen, and here we go. So this is the overview. I'm going to give you that sort of overview of basic physiology, some of the history of essential fatty acids. Then we'll look at their role in inflammation, the role in preventing certain cardiovascular disease problems and managing them as a complementary factor. The studies that have been done on arthritis, some I've shown you before, the role of essential fatty acids in brain support, helping to prevent, to some degree, Alzheimer's disease, managing concussion, improving the child's brain development and birth weight. You'll see in pregnancy, it's also very important. Some of the evidence we have on cancer prevention, the role in premenstrual syndrome, improving the texture of the skin and managing some skin conditions, even helping to reduce the likelihood that skin changes will occur that may lead to skin cancer. Some recent studies on omega-3 fats and longevity, and some other health benefits from diabetes to vision. You're going to see a number of other things at the end. They're just too long to list them all on the first page. If you are a student of essential fatty acids, I would suggest strongly that you read this review paper that was published in 2014. You can get to the link right here of the full text paper. It's a fantastic review of the physiology that I'm about to show you. This really is a fabulous reference that's fairly up to date, that gives you sort of the complete understanding of essential fatty acid physiology in the body, as I'm going to refer to it in the upcoming slides. But then in 2019, there was this great sort of review paper that was published, sort of reviewed the history of essential fatty acids in health and disease, which I really like. And it really was back in the 70s when Bang and Dyerberg were the first ones to notice that in what we used to call Greenland Eskimos, but now they would be Inuit, that they have very low cardiovascular disease. And this became attributed, of course, to their high omega-3 fat intake from eating seal and whale blubber. And that's when the real emphasis on essential fatty acid research began. It wasn't really until the 1970s that any of this was even on our radar. But since then, we've learned a lot. So omega-3 fats are considered essential because the body can't synthesize them. You have to get them from food, as you likely know. And once in the body, omega-3 fats are converted into different types of eicosanoids and other factors like resolvins that have these great anti-inflammatory effects. And more recently, we see there are these sort of free fatty acid receptors. And when omega-3 fats stimulate those receptors, it even improves insulin sensitivity to help diabetics and pre-diabetics. It turns on brown fat, which helps a person burn more calories while they're at rest. It has some gentle analgesic properties by stimulating the release of endorphins, and may produce effects on satiety to reduce food intake. So there's all these new findings around omega-3 fat physiology as it applies to sort of clinical situations. So you probably know this. I'm just going to review it. When you put polyunsaturated fats into your body, over and above the fact that they can be used for energy, just like saturated fats and trans fats and monounsaturated fats. Some of the polyunsaturated fats actually get incorporated into the phospholipid structure of the cell membrane of all your cells. And then every 5 to 15 minutes, phospholipase A2 releases some of those fatty acids, those polyunsaturated fats, and they get converted into different eicosanoids or prostaglandins, as they're sometimes called. And the types of fats that are inside your phospholipids are a mirror image of the kinds of fats that you're eating from day to day. So if you're eating a lot of omega-3 fats, you have a lot of omega-3 fats in your cell membrane. If you're eating a lot of saturated fat from meat and cheese and coconut oil, then a lot of the fats in your cell membrane are going to be those kinds of fats. If you're eating a lot of olive oil, it's going to be more oleic acid. If you're eating a lot of corn oil, you're going to have more linoleic acid. So your cell membrane is a mirror image in terms of the fatty acid composition of the types of fats that you eat. And the turnover rate for fats that are being used structurally in the body is usually about 300 days. So it takes a long time for one of your patients to change the free fatty acid profile of their cell membranes. It takes almost a year to really do that. And that's why to look for changes in outcomes, sometimes it takes when you're using essential fatty acids as a supplement or you're changing the person's dietary fats, it often takes many months before they start to see decreased inflammation, better brain function, and better insulin sensitivity. It takes a while to see significant changes because the turnover is slow. So again, the polyunsaturated fats are esterifying the phospholipids in your cell membrane. Phospholipase converts some of those polyunsaturated fats into these mini hormones, let's call them prostaglandins. And of course, prostaglandin series 2 produces a lot of inflammation. And you make prostaglandin series 2 from arachidonic acid. Arachidonic acid is found in large quantities in a lot of common corn oil and seed oils, sunflower seed oil, safflower seed oil, mixed vegetable oils. Whereas prostaglandin series 1 and series 3 are very anti-inflammatory. And so borage seed oil and flaxseed oil and fish oil help to produce more of the anti-inflammatory prostaglandins, as you likely know. So the foods that a person eats in terms of the polyunsaturated fats has a huge effect on their body, including joint inflammation. So the the top level view, again, is that when there's a lot of arachidonic acid that's in the cell membrane, it gets converted to prostaglandin series 2, which tends to increase inflammation just directly because of the prostaglandins that it produces. PG2 is inflammatory, but prostaglandin series 2 also increases the release of another very inflammatory cytokine called nuclear factor kappa beta, which actually increases the release of many inflammatory cytokines that make many arthritic conditions worse. And prostaglandin series 2 also speeds up the rate at which cells divide, which increases cancer risk. It also increases the synthesis of thromboxane in your platelets, thromboxane A2, which makes your platelets a little more sticky, increasing the likelihood that abnormal clots can occur that lead to a heart attack or some type of peripheral vascular blockage. And prostaglandin series 2 tends to promote more brain inflammation linked to dementia, Alzheimer's disease, depression, and other neurodegenerative conditions. So arachidonic acid is sort of the enemy, if you will, as is prostaglandin series 2. Whereas icosapentaenoic from fish oil directly gets converted into prostaglandin series 3. It has the opposite effect. Decreases inflammation, decreases the release of nuclear factor kappa beta, reducing inflammation and cytokine inflammatory reaction, slowing the rate of cell division, which slows aging, maintains telomere length at the end of your DNA, is associated with less cancer risk. And you'll see the studies here on EPA and other omega-3 fats related to decreased depression and the treatment of depression, Alzheimer's disease, and treatment of mild cognitive impairment, helping to reverse that to some degree. Omega-3 fats treating postpartum depression where other drugs can't be used. It's a fantastic intervention for these women. It also makes your platelets a little less sticky, less chance of abnormal clots, and linked to decreased arrhythmias and also lowering blood pressure. So the more omega-3 fat and PG3 that you have in your body, usually the better are the health outcomes for a number of health outcomes. The same is true for making prostaglandin series 1. And as you age, what becomes important is that it's hard for your body to make prostaglandin series 1. You're going to see why in a moment. But as you give people borage seed oil, which is 22% GLA or gamma-linolenic acid, the body has a chance to make more of this anti-inflammatory prostaglandin. It's been helpful in all kinds of conditions, from eczema to diabetic neuropathy, slows down the rate of cell division, reduces inflammation, may and therefore be of importance in decreasing cancer risk as well, like prostaglandin series 3. So let's drill down on essential fatty acids and inflammation a bit more. So when we look at the cell membrane structure, you have this biphospholipid structure. I've shown this to you a number of times. And you also have these receptors on the cell surface here. And so the phospholipids, what they look like is it's a glycerol backbone, and there's two polyunsaturated fats. Sometimes there's two fatty acids attached to it. It could be saturated fat, could be oleic acid from olive oil or olives or avocados. Or it could be a polyunsaturated fat from vegetable oils, or from fish oil or flaxseed oil or borage seed oil. And then one of the carbons has a phosphate group, say like choline. So if this were choline and you had two of these fatty acids, this would be phosphatidylcholine. So one thing to point out early, because we're going to see it later, is that the more of the R2 fatty acid is DHA from fish or fish oil, right? Docosahexaenoic acid and omega-3 fat, the greater is the likelihood in the presence of choline, if there's enough choline here to make this phosphatidylcholine, the greater is the chance that choline is going to become acetylcholine to maintain memory as people get older. So I've talked about this in the concussion program that I taught earlier, but just as a reminder, it's also important that if you have a lot of arachidonic acid as these essential fats, more of that's going to become prostaglandin series 2. Whereas if you have more icosapentaenoic acid from fish or fish oil, more of these fats, when they get cleaved off by phospholipase A2, will become prostaglandin series 3. So what it looks like again, here's a fatty acid chain, here's a fatty acid chain, here's the glycerol backbone, here's the choline. So this is phosphatidylcholine. And again, when the R2 carbon is DHA, when DHA is that fatty acid, memory is better. And so is the fluidity of the nerve cell membrane if it's more omega-3 fats, which means the receptors tend to work better. So often what happens is that because of the North American diet, a lot of people have a lot of arachidonic acid as these fatty acids in their phospholipid structure of their cell membrane. And then phospholipase A2 comes along and releases that. Now, one of the things that can block the inflammatory process are steroid hormones, because they block phospholipase A2. That's why in certain autoimmune diseases, they give prednisone, when things are really out of control, because they want to block the conversion of arachidonic acid into prostaglandin series 2 by inhibiting phospholipase A2. But that's how important this physiology is. So now we start making the picture a little bit bigger. So as the arachidonic acid gets released from the phospholipid in the cell membrane by phospholipase A2, now it can become prostaglandin series 2, which produces a great deal of inflammation and also upregulates nuclear factor kappa beta, which causes the nucleus of many immune cells to produce many inflammatory cytokines, as you're going to see. And in platelets, you form a lot of thromboxane A2, and that makes the platelets stickier. And that increases cardiovascular risk. A piece of your plaque in your coronary vessels breaks off a little bit. And those platelets, if they're excessively sticky, form a clot very immediately, and that you're having a heart attack, or the same thing happens in your brain. You're having an ischemic stroke. Also, in white blood cells, arachidonic acid follows the lipoxygenase enzymes to form leukotriene B4. That's also very inflammatory. So the take-home message here from a nutrition standpoint is that if I have less arachidonic acid in the first place, I'm making fewer of these inflammatory prostaglandins, and I'm not making my blood as sticky. And how come everybody over 50 has to take an aspirin a day to thin their blood? It's because of the way they eat. They don't really need the aspirin, in my opinion. if their thromboxane A2 levels were lower, they wouldn't need to have something to block that from occurring, because aspirin works right here at this particular step by blocking cyclooxygenase right here. And so do a lot of non-steroidal anti-inflammatory drugs. So again, here's phospholipase A2 forming arachidonic acid. And once again, non-steroidal anti-inflammatory drugs block cyclooxygenase, decreasing inflammatory prostaglandins, but also then blocking the conversion of arachidonic to thromboxane A2. That's how aspirin acts as an anticoagulant. But it's a very powerful one, and so is indomethacin and Voltaren and these other ones, and they can lead to internal bleeding because they block platelet thromboxane to such a significant degree you can now have bleeding. So these drugs have very profound effects. What you'd like to do, if you can, is through nutritional medicine intervention and dietary strategies, get just the right balance of these things so the platelets can clot if they need to. You don't increase risk of gastrointestinal bleeding or bleeding into the brain, but you don't have platelets that are excessively sticky as well. They're going to form abnormal clots. And diet, exercise, supplementation is really the primary pathway to do that for most people, unless they have a certain health condition where drugs are absolutely necessary. So if we expand the picture a little bit larger now, you see that arachidonic acid via cyclooxygenase becomes prostaglandin series 2, very inflammatory in white blood cells, leukotrienes, which are very inflammatory as well. But EPA, icosapentaenoic acid from fish oil, using the same enzymes becomes prostaglandin series 3, which is anti-inflammatory, and leukotrienes that are anti-inflammatory. So there's this sort of tug of war. You want to try to have a better ratio of arachidonic acid to EPA, as you obviously know already, or you wouldn't be attending this webinar. So let's make the picture now a little bit broader. So here's linoleic acid, which is an omega-6 fat that you get from corn oil, sunflower seed oil, safflower seed oil. Most mixed vegetable oils have a lot of linoleic acid. Linoleic acid can slowly, the body requires about 1% of the diet to be linoleic acid. Without that, you'll actually have an essential fatty acid deficiency. So you need some linoleic acid. But the North American diet is 7% linoleic acid. So the extra linoleic acid, the body starts converting it down to arachidonic acid using these enzymes, delta-6 desaturase, elongase, and delta-5. Once you have a lot of arachidonic acid, you can either eat foods that have a lot of arachidonic acid, like high-fat pork and beef products, or you can just have the wrong polyunsaturated fats going into your body, and your body will still make arachidonic acid. And from there, you start making prostaglandin series 2, which is inflammatory, and thromboxane A2, which makes your platelets excessively sticky, and leukotrienes that produce inflammation via your immune cells. On the way down from linoleic acid, you come to gamma-linolenic and then dihomo-gamma-linolenic. And from DGLA, under the right circumstances, you can take the detour to prostaglandin series 1. But you need to be alcohol-free, trans-fat-free, and have the right antioxidants, B vitamins, and certain minerals that help to drive this pathway this way. And as people get older, the delta-6 desaturase enzyme becomes more sluggish or not that active. So a lot of people end up having trouble making prostaglandin series 1. You'll see as you get older, it's a good idea to supplement with an oil that gives you lots of GLA, gamma-linolenic acid, to help make this conversion occur. You say, don't any oils have dihomo gamma-linolenic acid? The only source of DGLA is actually human breast milk, which is not accessible. So the idea is you have GLA to convert to prostaglandin series 1 under the right circumstances. Cancer cells like to make this conversion and use these particular prostaglandins via the 15-lipoxy to stimulate their cell division. So too much linoleic acid is a problem. Here we have the EPA, icosapentaenoic acid from fish and fish oil. And you notice that it directly gets converted into prostaglandin series 3, all these anti-inflammatory prostaglandins, makes platelets a little less sticky. Notice that DHA from fish and fish oil can also become EPA, and EPA can become DHA. So they can go back and forth depending on the body's need. And a really good fish oil would have both EPA and DHA decent concentrations. Here's alpha-linolenic acid from flaxseed oil. Flaxseed oil is 57% alpha-linolenic acid. Using the same enzymes that convert linoleic acid to arachidonic, if you have a lot of ALA that you're ingesting, this reaction goes faster, and this reaction down to arachidonic acid goes slower. And this is one of the ways that you help to increase your omega-3 fat to omega-6 ratio in the phospholipids of your cells, not just by having fish and fish oil, but also using flaxseed oil to help make this pathway go and slow this pathway down. And then if you give the person gamma-linolenic acid, you can make this pathway work very efficiently with the right vitamins and minerals. And you end up with lots of prostaglandin series 1 and series 3, which have all the great health effects, and you minimize the effects of arachidonic acid, and you minimize the concentrations of arachidonic acid and all its negative side effects. So again, this is just the same thing repeated. Here's the alpha-linolenic acid from flaxseed oil becoming icosapentaenoic acid, forming prostaglandin series 3. Here's linoleic acid becoming arachidonic acid, and then there's your prostaglandin series 2. So if we just talk about that prostaglandin series 1 for a moment, this is this delta 6 desaturase enzyme. As we get older, it becomes more sluggish. And so giving people gamma-linolenic acid from borage seed oil in just this one step down to elongase makes it very easy to make more prostaglandin series 1, provided, as you'll see from the research, you're giving people higher doses of antioxidants like vitamin C and E, along with B6 and zinc and magnesium. That's why a high potency multivitamin along with essential fatty acids is the ideal way to produce these healthier prostaglandins, while at the same time the person is making dietary change not to ingest so much of the bad fats. So we'll come back to that. So just to remind you what these things look like, here's alpha-linolenic acid. It's an omega-3 fat. So here's the methyl end of the omega N. And so at the third and fourth carbon is where you have the first double bond. So there's alpha-linolenic acid. It's an omega-3. Here's icosapentaenoic acid. It's just 2 carbons longer than alpha. Here's docosahexaenoic acid. Again, it's an omega-3. It's 22 carbons long. And then linoleic acid is an omega-6 fat. See, it's between the 6th and the 7th carbon that you have the first double bond. These small changes in physiology or in structure have profound effects on the physiological effects that occur in the body. And then once again, linoleic acid can be elongated to arachidonic acid, or you can just eat foods that have a lot of arachidonic acid like beef and pork. And now you're loading up your body with this omega-6 fat that in one step becomes a very significant inflammatory prostaglandin with other negative side effects. And then again, the difference between saturated fats, which can raise cholesterol and make the cell membrane very stiff and rigid. And then here's oleic acid, the omega-9 from, say, olive oil and avocados, which is a healthy fat as well. It doesn't make prostaglandins, but has other good effects on making the phospholipids very fluid-like, so the receptors work very well. May help to raise HDL levels and have other positive effects. And then we've looked at some of these other polyunsaturated fats on the previous slide. So the point I'm making is, one of the points is that when the cell membrane has a lot of omega-3 fats, the channels are open for things to move in and out of the cell, and the receptors on the cell surface can move and pick up signals more easily. During pregnancy, as an example, we'll see this a bit later, through the placenta, the child is taking a lot of DHA from the mother's body for its own brain development. So the mother's body now becomes depleted in DHA if she's not careful. And so her cell membrane now starts to look more like this image on the right, where there's not a lot of omega-3 fats. You have more saturated fats or trans fats, and the cell membrane becomes much more rigid. It's like butter that's hardening in your fridge versus flaxseed oil, which is still semi-liquid in a refrigerator. The cell membrane is hardening, so the receptors on the cell surface become rigid. They can't pick up signals as well. And it leads to postpartum depression in the mother. And if she doesn't have enough DHA to pass along to her child,
then the pregnancy outcome is likely to be compromised. A shorter gestational period with a lower birth weight and less brain development and a lower IQ in her child. So it's not just so much that they're, you're making receptors don't work too well and the cell membrane is a little bit rigid. This has profound effects on both the person's body, but also if it's a woman on the outcome of her pregnancy and the IQ level of her child. So once again, if we look at the phospholipid structure, when R2 is DHA, that's usually good news for a lot of reasons. And these omega-3 fats really determine many of the properties of the cell membrane so that these receptors that have to pick up all kinds of signals are moved. There's plasticity and movement, and they pick up signals in a way that helps to decrease risk of depression and other problems, as you'll see, in terms of molecules moving in and out of the cell. So when you have a lot of saturated fats in the diet and not a lot of omega-3 fats, then the cell structure is pretty rigid. When you have more unsaturated fats, then you have more space so that the channels are open up so things can move in and out of the cell more easily, including getting blood glucose into the cell through receptors so that you have better glucose control. When you have a lot of saturated fats and trans fats in the cell membrane, it's rigid and the insulin receptor itself doesn't work that well. The GLUT4 transporter doesn't work as well. And it's also hard to get toxins to leave the cell. So more toxic materials can build up in the cell because the cell membrane, the gates are not open wide enough for things to move in and out. I think you're getting the picture. I referred to nuclear factor kappa beta earlier. And what I'm saying is that inside any given cell, there's this nuclear factor kappa beta that usually sits there and it's silent. But upon activation of prostaglandin series 2 made from arachidonic acid, that nuclear factor kappa beta will translate to the nucleus and upregulate all kinds of genes. And here you see it again, nuclear factor kappa beta coming to the nucleus, activating genes, and here it is, that produce a lot of inflammatory cytokines. So now you get this massive sort of inflammatory response. So any of your patients with osteoarthritis or autoimmune diseases or inflammatory conditions, problems are made worse if there's a lot of arachidonic acid in their cell membrane. The condition is made better if there's less arachidonic acid and there's more omega-3 fats to simplify it, as you're going to see. So let's move to essential fats in cardiovascular disease. So that should say the Journal of Nutrients in 2021. It's not 2020. The year 2029 is still down the road. This was a report that was published this month, actually, as I'm speaking to you. Showing that omega-3 fats were able to reduce thromboxane B2. So I'm not sure what year this was. I'm going to have to go back. If you click on that link, it'll tell you the year of this study. It may not have been this year, but it's very recent. Just showing that omega-3 fats help to make platelets that are less sticky and immune cells that produce less leukotriene before that are anti-inflammatory. And this was true even in high-risk cardiovascular patients and rheumatoid arthritis patients. In cardiovascular patients, you don't want to have a lot of inflammation in the blood vessel wall. You don't want to have a lot of sticky platelets. In rheumatoid arthritic patients, you want to help to decrease the inflammatory profile and environment within the body. In 2002, a great report from the New England Journal of Medicine saying evidence has shown that patients with higher mean baseline blood levels of omega-3 fats are at lower risk for cardiac sudden death. Significant. So what this really is telling us is that there's a thing called the omega-3 index, which I've spoken to you about in previous webinars. Some of the omega-3 fats that you ingest become part of the cell membrane of your red blood cells. And your red blood cells turn over every 120 days. So if you look at the phospholipids in the red blood cell membrane, you get a pretty good snapshot of your omega-3 fat intake over the last number of months. So if your red blood cell omega-3 fat content comprises at least 7 or 8% of the fatty acids that are in the phospholipids, that's known as an 8% omega-3 fat index. And as you approach 8%, the higher you get towards 8, the better seems to be the risk factors with respect to cardiovascular episodes for a number of cardiovascular conditions. So omega-3 fats have a direct effect on cardiovascular risk. So in the Mayo Clinic in 2014 said there can be little doubt that myocardial omega-3 fat plays a physiological role in the prevention of life-threatening ventricular arrhythmias, and that high-level omega-3 fat intake has the potential to benefit vascular health via additional mechanisms. If across the population we raise the omega-3 fat concentrations in people's myocardium and their red blood cells, their cardiovascular deaths would decline just from that one intervention alone. We see in 2014 these other studies showing this major clinical study involving 11,000 patients with recent heart attacks. Were given 1 gram a day of omega-3 fats and reduced the occurrence of death, cardiovascular death, and sudden cardiac death by 20, 30, and 45% respectively. The group that got the just 1 gram of omega-3 fats get this kind of an outcome because of the profound effects on clotting, inflammation, decreased arrhythmias, all of these factors that sometimes are overlooked in the typical management of the cardiovascular patient. I've shown you this in the blood pressure webinar. I don't want to repeat things, a million times. The role of flaxseed oil, the alpha-linolenic acid from flaxseed oil, the studies that show that it can help to reduce blood pressure. So there's studies in 2005 showing higher alpha-linolenic acid concentrations are associated with lower blood pressure. And then you have these other intervention studies of people with high risk for cardiovascular disease given flaxseed oil for a 12-week period, and you get all these improvements in high blood pressure and so on in people that are in a high risk category to begin with. It's bringing your blood pressure down. The safflower seed group doesn't get the benefit. So after 12 weeks, you get this decline in blood pressure that really translates into a dramatic reduction in risk of heart attack and stroke. And then also with atrial fibrillation, flaxseed oil supplements may reduce the risk of developing atrial fibrillation, a condition affecting 9% of people over the age of 65, also linked to decreased sudden death. So it's not just fish oil that has these benefits. People are crazy with salmon oil, fish oil, eating more fish. Flaxseed oil has to be factored into the equation here. It should be part of the supplementation strategy for a number of reasons, including some of the experimental studies showing that it can reduce the risk of colon cancer as well by slowing down the rate of cell division, making more prostaglandin series 3. And of course, over the last 100 to 150 years, the human diet has changed so much. We now tend to have this high omega-6 intake and low omega-3 fat intake, just due to food processing, the way animals are fed today. You know the story. So you want to help your patients bring that thing back into balance as best you can from this crazy 20 to 30 to 1 ratio that exists today. And if we make that possible, you start to reduce these inflammatory mediators and these things that cause cells to divide too quickly and cause increased platelet clumping. There's a whole lot of benefits if we can improve that ratio over time. So here are those references again on flaxseed oil that I was referring to. This is the omega-3 fat index that I spoke about earlier. When that omega-3 fat index gets to around 8%, you start to see dramatic changes in risk of blood pressure, and you also see better health outcomes across the board, decreasing cardiovascular problems, including congestive heart failure, heart attack, and stroke. The evidence is very consistent that if you look at red blood cell omega-3 fat content, if it's 8%, if it's around 8% of the fatty acids in the phospholipids, the risk for a lot of these things is significantly lower. And as you give people omega-3 fats via supplementation, slowly over time, the omega-3 fat index increases. It's not like, well, my omega-3 fat index is 2. There's nothing I can do. I guess that's genetic. Well, that's completely wrong. As you start to supplement and make better dietary changes over time, your omega-3 fat index increases and you put yourself into a lower risk category. And in recent years, because of the way young people eat today, you're seeing they're having blood pressure problems much earlier in life, and there's a greater percentage of them having these problems. And a lot of this is diet and lifestyle related, not some genes that they inherited. What about arthritis? Well, a lot of this makes sense to you. I showed you this when we talked about arthritis before. Studies have shown that when you give people omega-3 fats versus placebo, that even in rheumatoid arthritic patients, they start to do much better. Again, in 2016, a 12-week study with patients with rheumatoid arthritis, not, just giving them, amounts of EPA and DHA that are not super high, just reasonable amounts, improving all kinds of parameters. And some of these people now requiring less medication, some of them going off their medication completely because they just don't have the same inflammatory response. But it takes time. It doesn't happen in a week or 2 weeks, in this case, 3 months. But in some cases, it might take 6 to 12 months where the person has a more severe disease. Study in 2020 also showing that omega-3 fats, EPA and DHA, also form these anti-inflammatory resolvins. So in addition to prostaglandins, EPA also becomes the E-series resolvins, which are also anti-inflammatory, and DHA becomes the D-series resolvins, which are also very anti-inflammatory. So they have many sort of anti-inflammatory mediators that they form. It's not just one type of prostaglandin. They form different types of end products that all have anti-inflammatory effects that can have a profound outcome over time in many inflammatory conditions. So the clinical studies continue modulating cytokine secretion in rheumatoid arthritic patients given fish oil. The same thing, decreased tumor necrosis factor alpha, decreasing nuclear factor kappa beta, decreasing increased cytokine release. This is what you want, trying to make drugs that can do this. So the conclusion is that omega-3 fats have a role to play in these inflammatory conditions. Even in the Journal of Rheumatology in 2020, you have published papers that are saying this. But a lot of this gets ignored, in day-to-day medical practice. So it's sort of up to you to kind of fill in the blanks and help people produce complementary measures that are going to be helpful in outcomes. In terms of borage seed oil and rheumatoid arthritis, there are studies showing that gamma-linolenic acid can also be helpful to tone down the inflammatory response. It's not all about fish oil. It's not all about flaxseed oil, but borage seed oil needs to be on your radar as well. One of the early studies using borage seed oil dates back to 1993, decreasing tender joints and all these swollen joints, and significant improvement when gamma-linolenic acid was given via borage seed oil versus cotton oil as the sort of the comparable. Studies on osteoarthritis show that omega-3 fats also can decrease experimental osteoarthritis in guinea pig studies. But again, through the same mechanisms, it's doing the same thing, decreasing prostaglandin series 2, increasing prostaglandin 3, toning down the release of inflammatory cytokines. So, if you can manage or you can improve rheumatoid arthritis, you can very likely improve osteoarthritis, which is not as severe a disease. In terms of how many moving parts there are and the inflammatory cytokines that go with it. So, this, as part of prevention and complementary management, these essential fats become part of the story in the overall management. Essential fats also play a big role in brain health, brain function, preventing and co-managing depression, concussion management. We'll look at some of this. So we'll start with depression. There's all kinds of small studies showing that omega-3 fats can be helpful in the treatment of different types of depression. And where women who are pregnant or they're breastfeeding can't use medication for their depression, omega shown to be extremely helpful. Why? Because it improves the fluidity of the cell membrane so they can start picking up the serotonin receptors, the dopamine and norepinephrine receptors start working again. So the brain is responding to these neurotransmitters that produce well-being. You're also reducing brain inflammation, decreasing inflammatory cytokines in the brain. When you do that, the risk of depression is lower and depression management is better. You need those receptors on the cell surface to be receiving signals properly, so you need the right fluidity in the cell membrane. So that fluidity is determined by the types of fats you're eating and ingesting, because those are the fats that are going to determine the fluidity of your cell membrane as to get incorporated into the phospholipids. And those same fatty acids determine if you're going to make inflammatory prostaglandins or anti-inflammatory prostaglandins, also affecting depression. And also, as I said earlier, DHA is required for brain development in the child, both during the last trimester of pregnancy, especially, and in the first 6 months of life during breastfeeding. There has to be enough DHA in the maternal body to pass this along to the child to get optimal brain development and a higher IQ, which is an endpoint that's measured in these kids to show that higher DHA translates into more intelligence. So these are just some of the trials, fish oil and depression. Some of these studies are small, but they're meaningful. They show overall, if you really break it down, that omega-3 fats should be part of the complementary management of depression. And in women who have postpartum depression, it can be used as the single intervention that actually helps get them out of it, where certain drugs, they're not able to use them because it might be damaging to the fetus. Some of the other omega-3 fats, and here's a recent study report in 2015, basically the same thing, showing that omega-3 fats are useful as a supplement in the treatment of bipolar depression, and may be helpful. And you're going to see in other slides that it's sort of should be part of the standardized treatment. There's significant evidence that it may be also helpful as complementary treatment in schizophrenia and bipolar depression disorder. Symptoms of dementia can be reversed. We're going to see that. So finally, omega-3 oil pills are used in combination with serotonin reuptake inhibitors like Prozac, and are considered as more standard treatment for depression as recommended by some physicians. So in other words, it should be incorporated as part of the co-management in conjunction with medications in these cases. Here's a good example of the person given the serotonin selective reuptake inhibitor fluvoxamine, which is a common antidepressant. The results are better when you give the person the omega-3 fats versus the group that doesn't get that. The studies, one after the other, show the same thing. Both EPA and DHA particularly helpful in this regard. And also in post-traumatic stress disorder, right? Studies giving omega-3 fats to these individuals who've been traumatized this way has shown outcomes here in 2016, another study in 2017 with 83 patients, showing that they stop having the pounding of the chest and the racing heart rate. Things calm down and they feel calmer. That's the only intervention they were given. Let's just test omega-3 fats by itself as a standalone intervention. Let's see what happens over 12 weeks. Oh, versus the placebo, there's a dramatic change. But is this actually being practiced day to day in the medical conventional channels? It may be. I just haven't seen signs of it in terms of, widespread use. So this is where you need to have this on your radar to help these individuals. With respect to memory and Alzheimer's, as I said earlier, when the R2 fatty acid in the phospholipid chain here is DHA, and that's only through fish consumption and fish oil consumption that you're really going to maximize your DHA. You could do it through just alpha-linolenic acid alone, but it's hard. It takes a long time for the ALA to become EPA. Then you have to get some of it to become DHA. So vegetarians and vegans tend to have lower DHA levels because it's hard. Even if they have a lot of flaxseed oil and alpha-linolenic acid from seeds and nuts, they still don't make as much DHA as we think is optimal. Just so you're aware of that. But when that R2 is DHA and you have enough choline in your body from I like to take a lecithin capsule personally. I mean, after the age of 55, I suggest you take the Adëeva product memory support complex because it has CDP choline and phosphatidylcholine in it, which are the ones that cross the blood-brain barrier really well. So you have enough choline in the brain to make acetylcholine, which is the brain memory chemical. But when the R2 is DHA, that really pushes things along and you tend to have better memory and reversal of memory loss. So there's all kinds of studies showing that more omega-3 fats over time in the body and blood levels and nutritional status of omega-3 fats is associated with less Alzheimer's disease as you age. The Zutphen elderly study is just one example. There's other ones like the Framingham Heart study. But in the Zutphen elderly study, they've been able to establish that 400 milligrams a day of omega-3 on average, it seems to be enough to decrease risk of Alzheimer's disease as people get older. And why is that? Because it decreases brain inflammation, improves cell fluidity, Also, prostaglandin series 3 causes vasodilation, more blood flow through the cerebral vascular vessels to get more nutrients to the brain cells. But also, DHA in particular upregulates the LR11 receptor, which prevents the buildup of beta amyloid plaque. So here's some of the references so far. But there's normally this amyloid precursor protein, which is a receptor on brain cells. But then when you start moving towards Alzheimer's disease, enzymes come and sort of chop this up, and you end up with this beta amyloid plaque. So first you have a normal receptor, then enzymes break it up, and you end up with these beta amyloid plaque pieces in the brain that then are a hallmark feature of Alzheimer's disease. How do you prevent that? You prevent it by upregulating the LR11 receptor with DHA. That's what we've learned about this. So this is the gene that codes for the LR11 receptor. It's defective in a lot of people who are on the way to Alzheimer's disease. You can turn on that gene and upregulate the LR11 receptor, and what turns the gene on is DHA. There are no drugs that can do it. Only DHA, docosahexaenoic acid from fish oil, is the only thing we've ever seen that can turn on DHA, get enough DHA into the brain to upregulate the LR11 receptor and block the steps that lead to beta amyloid plaque. So higher brain levels of these things are significant. Then you have these intervention studies. Here's one in 2015 showing that omega-3 fat supplementation in people with early stage Alzheimer's and people with mild cognitive impairment, particularly in people with mild cognitive impairment, it reversed it. But even in Alzheimer's patients, it tended to get the macrophages to go and start gobbling up the beta amyloid plaque, reducing the beta amyloid plaque, even in the Alzheimer's patients' brains. No drugs can do that yet. So this is really eye-opening stuff. As the authors say, our study is the first to show significant immune and biochemical effects of omega-3 fats with antioxidants in patients with minor cognitive impairment. So what they did is they gave people omega-3 fats along with vitamin D and drinks like pomegranate juice and chokeberry that are high in antioxidants. That combination of those three things produced a great result in reversing mild cognitive impairment, and also tended to get a breakdown or sort of a reduction in the amount of beta amyloid plaque in the brains of the Alzheimer's patients. It's quite incredible. You also see that SPECT scan studies show that the omega-3 fat groups, the ones with higher omega-3 fat status, have better blood flow to 128 different regions in their brain, because prostaglandin series 3 causes vasodilation, including cerebral vessels, to get more blood flow. And with more blood flow, learning, memory, and the prevention of depression and dementia is significantly affected in a positive way. So, again, this is just one more factor, the vasodilation effect of the omega-3 fats via prostaglandin synthesis. What about essential fatty acids in cancer? This study was published just this month. This is the one I was trying to refer to earlier. It's experimental evidence, but we have a lot of studies showing epidemiologically and prospectively that people with more essential fatty acids, that are the good ones, the omega-3 fats and flaxseed oil as an example, they tend to have a lower risk of certain types of cancer, of many different tissue organs. So in cancer cells, they tend to not use mitochondria that much. They don't like to use oxidative phosphorylation, because when they do that, they generate a lot of free radicals that can cause cell death, because tumor cells don't have a lot of antioxidant protection. They don't make a lot of antioxidant enzymes for themselves. So when you give them a lot of DHA, as was done in this study, the DHA overcame the amount that the tumor cell could handle, and the DHA started to undergo oxidation and formed all kinds of free radicals, and the cancer cell couldn't protect itself. The cancer cells start dying off through apoptosis the more DHA you give to these cancer cells. It's saying, oh, this wasn't, when we gave other types of fats, this wasn't happening, but when we gave DHA, we actually see that this effect takes hold. And you're going to see that that people with better omega-3 fat intake, even if they have certain cancers, that the outcomes are better for them. That's why I showed you that. So with respect to prostate cancer, there was this study by this guy Brasky a few years ago that led everybody down the wrong path, suggesting that omega-3 fats may increase risk of prostate cancer. That's been disproven in all kinds of research, including this particular paper in 2013. Then a whole meta-analysis of all the studies that it's that omega-3 fats are strongly protective with respect to prostate cancer mortality. With respect to patients who already have prostate cancer, frequent fish consumption is associated with improved survival, not decreased survival. So some of your patients will have seen that published data a few years ago that was very erroneous, that got lots of media attention, saying omega-3 fats increase prostate cancer risk. I don't want to be taking fish oil or flaxseed oil. That has been refuted completely by the scientific community, including the studies in Lancet. That was a study by Brasky in 2013. Even the Mayo Clinic said the preponderance of evidence suggests that higher intake of omega-3 fats decreases risk of prostate cancer, advanced prostate cancer, improves survival in prostate cancer patients who have been treated, and is associated with increased longevity of 2.2 years versus groups who don't get omega-3 fats. Breast cancer, the studies are just emerging now showing that higher intakes are associated with a lower risk, but we need some real, intervention trials to confirm all of that. But the evidence suggests that it's likely that it's going to help prevent breast cancer, and they put the mechanisms down here in this review paper, all the things you would, slowing down the rate of cell division, decreasing inflammatory response, improving the lipid profile of the cell membrane. All these things are important factors in does cancer start and does it get traction? I showed you this study before on premenstrual syndrome, giving women with premenstrual syndrome 1,000 milligrams of fish oil versus placebo, decreasing a lot of the symptoms in PMS and improving their quality of life. What about the skin? Well, you've seen this condition in a lot of your patients, these little bumps on their skin like this. This is perifollicular hyperkeratosis or pilaris keratosis. It can be genetic, but in many cases, either essential fatty acid deficiency or imbalance, vitamin A or zinc. That's what you think first. So when you supplement these people, often this disappears. You sometimes see it on the lower leg. Here's an example of it sort of on the shoulders, little bumps, right? It can be hereditary, but in many cases, it's a deficiency or an imbalance of essential fatty acids. And there it is again. So here's a patient who needed parenteral nutrition. They forgot to put the essential fats into the person's nutritional intake, and within weeks they developed this type of skin lesion just from an essential fatty acid deficiency. So then they realized they made the mistake, and they gave the person the linoleic acid for a few weeks, and all the skin condition cleared up. So what we see is that not only is it do skin cells take essential fats that we eat and convert them into prostaglandins that are necessary to make the skin smooth and soft and decrease bumpiness. Studies also show that omega-3 fats in particular, when they make prostaglandin series 3 and series 1 in the skin, or particularly series 3, that even upon exposure to ultraviolet light, there's less damage to the skin that would lead to steps related to skin cancer. So that's what these studies are showing, that you increase what's called the minimum erythema dose or threshold. You start to raise it. You need more ultraviolet light to damage the skin in people that have a lot of essential fatty acids from omega-3s in their skin. Whereas if you have a lot of arachidonic acid or linoleic acid, trans fats, it takes less UV exposure to start damaging the skin and creating genotoxic effects. So fish oil had a significant effect on raising the threshold so that it took more ultraviolet light to actually create skin damage related to changes linked to skin cancers. And this becomes very, very important. And again, some experimental studies showing omega-3 fats are important here, but also with skin texture. The prostaglandins made in the skin are not just about inflammation and little bumps on the skin and decreasing skin cancer, but the actual softness and smoothness of your skin is determined by the prostaglandins that skin cells make. When they make more prostaglandin series 1 and series 3, your skin tends to be smoother and softer. So when a person changes their diet and starts using essential fatty acid supplements in the right combination, often their skin changes in texture and softness and sort of the less dry, less scaly, less rough, all those things. People want to have nice skin if they can have it. whereas prostaglandin series 2 tends to create skin that is less smooth and soft. So there's the skin needs linoleic acid because a lot of that linoleic acid gets into the skin cells, but from there, the linoleic acid in the skin often gets converted to gamma-linolenic acid and dihomo-gamma-linolenic acid, becomes prostaglandin series 1. So people that have sort of uh, these epidermal hyperproliferation where the skin is scaly and dry and you don't have really nice skin texture, studies dating back a number of years ago show that giving them evening primrose oil, which has gamma-linolenic acid, just like borage seed oil, but it only has 9% GLA, whereas borage seed is 22%. But by giving them GLA oil, it helped tremendously to improve skin texture because the skin really likes to make prostaglandin series 1 and series 3. And once again, if you give the person the right essential fats, you can clear up some of these crazy skin lesions that you see that would occur in a deficiency state. But omega-3 fats are also important in affecting skin texture. The studies show that. Feeding borage seed oil and fish oil are extremely helpful. One of the reasons is that in the skin, arachidonic acid moves down this pathway. Becomes HETE, which creates a lot of scaliness and roughness of the skin, whereas EPA from fish oil becomes this HEPA end product, which helps to reduce skin inflammation and improve skin texture. So there's all kinds of evidence to show the value of fish oil, flaxseed oil, and borage seed oil improving skin texture, decreasing changes that are linked to skin cancer, and reversing lesions of the skin, including eczema, and in some cases, but psoriasis is more difficult to treat, but in some cases, even psoriasis improves. So here are studies on eczema and psoriasis showing improvement when you give the person EPA and DHA, also gamma-linolenic acid for eczema, extremely helpful. And people with cystic fibrosis tend to also be atopic and they have skin lesions. Often this is because there's a delta-6 desaturase enzyme problem. As we get older, delta-6 desaturase is less active thing, and you don't get normal skin cell smoothness and prostaglandins. Once again, if you give people gamma-linolenic acid from borage seed oil, it becomes dihomo-gamma-linolenic and becomes prostaglandin series 1. If you do that with the right vitamins and minerals and you make some dietary changes so you don't overload the cells with arachidonic acid, skin improves even in people with eczema in many, many cases. And again, this is just showing that as you get older, the delta-6 desaturase enzyme in aging becomes less active. Alcohol will block it. Trans fats will block it. Deficiencies of certain nutrients will impair it. So this is where you need to have a comprehensive effect, not just giving borage seed oil in a supplement, but also trying to get less alcohol, trans fats, and giving antioxidants and B vitamins and minerals that will help to convert the dihomo-gamma-linolenic acid into prostaglandin series 1. That's an important consideration to slow down the rate of cell division and reduce inflammation throughout the entire body, but also make skin conditions better. And so the research just goes on and on along the same pathways, including alpha-linolenic acid from flaxseed oil, its potential to be helpful even in eczema. And again, decreasing skin cancer, steps that lead to skin cancer by decreasing prostaglandin series 2 and increasing prostaglandin series 1 and series 3. So all the evidence points in the same direction. This is just a recap of what I've been saying, but I've sort of beaten it to death. So you have it on the slides, what prostaglandin series 1 and 3 do versus prostaglandin series 2. At the end of the day, to optimize skin smoothness and softness, to give people Adëeva's Nature's Essential Oils that has the borage seed, the flaxseed, and the high yield fish oil in it is often very, very helpful, and including cases of eczema and people with little bumps on their skin. There's other benefits to essential fatty acids. I'll touch on them quickly. DHA is needed for vision. DHA is needed for brain development, as I touched on, and better IQ and pregnancy outcomes. And also essential fatty acids from omega-3 sources also improve uh, insulin function and improve insulin sensitivity, helping to manage blood sugar better, reversing also fatty liver degeneration, non-alcoholic steatohepatitis, all kinds of evidence for this. Also improving childhood asthma with a more omega-3 fat status, improving pregnancy outcomes as we touched on earlier. Uh, in the Nurses Health Study, more omega-3 fat status, a 40% reduction in risk of developing multiple sclerosis. And then just this month, a study looking at longevity indicators. The higher the red blood cell omega-3 fat content, the person, as you start to move towards like 8% omega-3 fat index, in older people, you see that they live almost 5 years longer versus groups that have lower omega-3 fat index in their red blood cells as an independent risk factor of mortality. That's just this month that was published. And again, also shortening telomeres, reducing oxidative stress, all these double-blind studies showing that these fats play a huge role. So to summarize, what you want to try to do over your lifetime, and with your patients as well, is to optimize your essential fatty acid nutritional status. So you reduce your intake of arachidonic acid and other bad fats from high fat beef and pork and high fat dairy products. And in terms of using oils on salad dressings or to stir fry or to saute, olive oil, canola oil, peanut oil, these are decent choices versus the other seed oils and mixed vegetable oils. Reduce your intake of high-fat animal products, also to get saturated fat down. Saturated fat carries endotoxins into the bloodstream from the gut that produce inflammation, and it also stimulates on the macrophages these toll-like 4 receptors that produce inflammatory response. And of course, deep fried foods and trans fats and battered foods, these things also tend to produce more inflammatory response. And then along with those dietary changes, I suggest people take a combination of fish oil, flaxseed oil, and borax seed oil every day. And that's what nature's essential oils is. It's a high yield fish oil. Like if you just buy fish oil in Costco, you're going to see the EPA is 18% and the DHA is 12%, as opposed to 30% and 20%. It's a high yield fish oil. So 50% of the fish oil is actually medicinal ingredients. Then you have flaxseed oil, which is 57% alpha-linolenic acid, and borax seed oil, which is 22% GLA. Evening primrose oil is only 9%. So when you put that combination together and you're maximizing prostaglandin 1 and 3 synthesis in the body, why are you doing it? You're doing it to reduce joint inflammation and the prevention and management of arthritic conditions and joint inflammatory conditions. You're doing it to support cardiovascular health, to prevent sudden death, heart attack, and arrhythmias, blood vessel inflammation, help to keep blood pressure down, decrease the platelet stickiness. You're doing it for your brain, for brain development, but also to make acetylcholine, reduce brain inflammation, decrease risk of depression, help prevent Alzheimer's disease, and help to manage mild cognitive impairment. You're doing it for possibly cancer prevention reasons, including in the skin, where it's also improving texture, decreasing the amount of damage done from ultraviolet light in your skin upon ultraviolet light exposure. Not that you should be, bathing in the sun like indiscriminately just because you took omega-3 fats. That's not the right message. The message is you're going to be exposed to some sunlight. You want to try to minimize the damage as best you can. Omega-3 fats and alpha-linolenic acid included help to do that. Decreasing sunburn reaction, co-management of eczema, possibly psoriasis, and also pilaris keratosis, managing PMS, improving your eye so you have vision throughout your entire life, improving the management for blood sugar control, for helping to reverse non-alcoholic steatohepatitis, fatty liver, for just the sake of longevity, maintaining your telomere length, anti-aging. Omega-3 fats are a huge part of this story. For pregnancy outcomes, of course, if you're going to give a pregnant woman essential fatty acid supplements, it has to be approved by their physician. And even in asthmatics, to improve lung health and make them less prone to asthmatic reactions when they're exposed to different particulates in the air, omega-3 fats have been shown to be helpful. So you also want to decrease the bad fats, and you need vitamins and minerals to make these pathways work. So in the International Journal of Molecular Medicine, we saw this again in 2018. You need vitamins and minerals to make this work optimally. That's why taking Adëeva high potency multivitamin with nature's essential fatty acids is the perfect combination. So to make a long story short, there's nature's essential oils, it works best when you also give them the foundational product, which is our high potency multivitamin, because it has the high dose vitamin C, the vitamin E, the B50 complex, the extra magnesium, the zinc, those nutrients that are required to make those enzymes work better to make the anti-inflammatory prostaglandins and suppress the inflammatory prostaglandin series 2 and all of its other related eicosanoids and cytokines. So that takes us to the end. We're a little bit over time. I'm sorry I had to go so quickly. I'll make these slides available. The research here is so compelling, and most people don't really understand it well enough. So it really falls to you to help educate them. I hope this was helpful. I'll take some questions if there are any in the chat box right now. Just let me check and see. I don't see anything, and I don't want to hold you up.